Hi guys, this is our country profile project on Sierra Leone, presented by Valerie King, Tommy Moll, Anna Scott Wingfield, Grace Readling, and Carleigh Crabtree. For those of you who don't know where the Sierra Leone is, it's located right here. Founded in 1961 after achieving their independence from Britain, this 27,699 square mile country is home to a diverse population. According to the UN, it is the 152nd highest GDP out of 192 countries, with a total GDP of $3.824 billion US. According to the CIA, the average life expectancy is a little over 57 years. The prevalence of HIV in Sierra Leone is 1.6%. Healthcare is not widely available to people living outside of urban areas, mainly Freeport, their capital city. But, like anywhere in the world, the key to understanding healthcare in Sierra Leone is understanding their culture.
Sierra Leone is a small West African country bordering the North Atlantic Ocean between the Republic of Liberia and the Republic of Guinea. As well as being a small country, only about 7.95% of the land is good for farming. Its population is about 6.2 million people, most of which live in urban areas. Despite its size, Sierra Leone is one of the most culturally rich countries in all of Africa, with several racial and ethnic groups living peacefully together. The country is rich with an abundance of natural resources, such as diamonds, titanium ore, iron ore, and gold, to name a few. However, despite these resources, Sierra Leone remains one of the poorest countries in all of Africa. Sierra Leone remains one of the HIV/AIDS killing zones in Africa today, with an adult prevalence rate of about 1.6%. About 50,000 people were living with the disease in 2009, with about 3,000 deaths recorded that year. Besides HIV/AIDS killer diseases such as malaria, Ebola, which is still not gone in Sierra Leone, bacterial and protozoal diarrhea, and yellow fever threaten lives today. In 2014 and 2015, Sierra Leone was overwhelmed by the Ebola outbreak. The healthcare system was already fragile, and with the disease, people stopped visiting health clinics, immunization rates dropped dramatically, fewer women gave birth at facilities, and medicine was frequently out of stock. This led to measles outbreaks and to treatment disruptions for malaria and TB.
The majority of the population in Sierra Leone is Muslim, with a large Christian minority. Both Muslim and Christian holidays are celebrated here. While the official language is English, Creole is a uniting language across ethnic groups. It is the primary language used in social and economic settings. 37% of married women are in polygamous marriages, despite being illegal under Sierra Leone's penal code. Diet here consists of rice with various sauces, fruits, nuts, bread, corn, meat, and shrimp. Radio is the most popular form of media, with 85% of people having access to it. Freetown is the largest consumer of print and television media. The national soccer team, the Leone Stars, matches are broadcast by radio and TV, and a win from them acts as a uniting force across the country. Sierra Leone is home to about 16 different ethnic groups. The Mende and the Temne are the largest groups, comprising of 36 and 39% of the population respectively. One of the things that makes this significant is that the two groups support different political parties. The Mende support the Sierra Leone's People's Party, while the Temne support the All People's Congress. The Limba, who make up 4.6% of the population, are indigenous to Sierra Leone. Many of the smaller minority ethnic groups are farmers, fishermen, and traders.
Sierra Leone's economy is that of a least developed country, or LDC. According to the United Nations, an LDC is a developing country that exhibits the lowest indicators of socioeconomic development, with the lowest Human Development Index ratings of all countries in the world. The Human Development Index is a statistic of life expectancy, education, and per capita income indicators, which are used to rank countries into 4 tiers of human development. The civil war that ravaged Sierra Leone from 1991 to 2002 destroyed their economy, giving it the rank of an LDC and one of the poorest countries in the world. Almost 75% of the population lived in extreme poverty, and many were displaced. However, since the end of the Civil War, the economy has been gradually recovering, with a GDP growth rate between 4 and 7%. About 17% of the GDP is spent on healthcare yearly. Sierra Leone's main export is diamonds, which has created a significant wealth gap benefiting the rich and paralyzing the poor. Because of the country's great dependence on this single mineral resource, economic growth is impeded. Successive governments and the population as a whole have always believed that diamonds and gold are sufficient generators of foreign currency earnings and lure for investment. As you can see in this graphic, a large percentage of the country's exports are made up of mined materials. As a result, large-scale agriculture of commodity products has been neglected. In turn, the country's economy could be described as exploitative, meaning it is based on the extraction of unsustainable and non-reusable assets. Where large-scale agriculture is neglected, 2/3 of the population of Sierra Leone is involved in subsistence agriculture, meaning farming to feed themselves and their families. This does not result in any surplus trade, meaning it is of no help to the economy. However, agriculture accounted for 58% of the GDP, with rice being the most important staple crop. Along with mining and agriculture, other industries in Sierra Leone include telecommunications such as radio stations and tourism.
After the Ebola outbreak in 2014, Sierra Leone saw a huge transformation and improvement in its public health surveillance with the introduction of integrated disease surveillance and response and the international health regulations into the curriculum used to train health personnel, all with the support of the World Health Organization. This initiative aims to support local institutions by educating health authorities and is set to be implemented in October 2019, which is hype because that is this month. Not only health authorities, but students also have the opportunity to take courses in IDSR and international health regulations at different levels. The curricula have been developed to meet the needs of medical, nursing, veterinary, and a bunch of other health-related academic positions.
Healthcare in Sierra Leone is generally charged for and provided by a mixture of government, private, and non-governmental organizations, also known as NGOs. There are over 100 NGOs operating in the healthcare sector in Sierra Leone. The Ministry of Health and Sanitation is responsible for organizing healthcare, and after the Civil War ended in 2002, the ministry changed to a decentralized structure of health provision to try to increase its coverage. In April 2010, Sierra Leone launched free healthcare medical insurance. This is a system of free healthcare for pregnant and breastfeeding women and children under 5. This system is expected to save the lives of more than 1 million mothers and children. The country has designed 3 main types of delivery points for primary healthcare. The Community Healthcare Center carries out health prevention measures, cures, and health promotion activities. The Community Health Post is similar to the centers, but there are fewer facilities, and they are used to refer patients to the hospital. Maternal and child health posts are the first level of contact and are located in smaller towns with populations between 500 to 2,000.
Sierra Leone has a high total fertility rate of almost 5 children per woman. This high fertility rate is caused by low rates of contraceptive use and a low mean age of motherhood, with the average Sierra Leonean woman having her first child at 19. Yet it has the highest maternal mortality rate in the world, with 1,360 deaths per 100,000 live births, and high infant mortality rates with 66.7 deaths per 1,000 live births. In order to lower these rates, the Sierra Leone government initiated the Free Healthcare Initiative. Since free healthcare for all Sierra Leoneans would be costly, their government decided to implement a system in 2010 for their highest risk populations. So the Free Healthcare Initiative, the FHCI, was implemented. Its goal was to decrease maternal, infant, and child mortality rates by offering basic healthcare services to pregnant and lactating mothers and children under 5. These services include postnatal care, integrated management of newborn and childhood illnesses, and treatment for non-communicable diseases, among others. This system provided great services like increasing the number of healthcare staff and upgrading health services. However, other residual barriers like a lack of transport and sociocultural barriers were not addressed. The FHCI was very cost-effective as it only cost about $420 per life saved. 2 years after its implementation, under 5 mortality dropped from 187 deaths per 1,000 live births in 2009 to 126 deaths per 1,000 live births in 2012.
In terms of sustainable development goals, Sierra Leone has recently launched the medium-term national development plan titled Education for Development. The country has identified SDG 4, which is education, and SDG 16, which is justice, as pivotal for pursuing its developmental agenda. In terms of SDG 4, since August 2018, the government has allocated 21% of the national budget to the Free Quality School Education Program to ensure that all children have access to basic education. In terms of SDG 16, Sierra Leone hosted the 16 Plus Forum annual showcase and the first technical consultation on SDG 16 for Anglophone African countries in Freetown in November 2018, and is setting up a Peace and National Cohesion Commission. In terms of SDG 8, the Decent Work Country program is now in place and has led to the development of the Labor Market Information System and the National HIV/AIDS Workplace Policy. The program has also facilitated the domestication of international conventions on the elimination of child labor.